The Cannabis Show is for information only. Nothing contained in the show is intended to constitute professional advice for medical diagnosis or treatment. We do not claim this information to be complete or exhaustive or to be applicable to any particular individual's medical condition. You should always consult with a qualified and licensed physician or other medical care provider.
Welcome to the Cannabis Show. On today's episode, we're going to talk about a strain with a fun name, the Shishkaberry. Also, learn about those edibles with MediKait. All that and more coming up. It's another edition of Terp Talk. I'm Chris with our bud genius, Basil. Today's terpene that we're going to be talking about, it's a tongue twister for me. It comes across as LOL. How do you say it?
Yeah, Linalool.
Linalool.
Yeah.
All right, now what can Linalool do for a patient?
Yeah, Linalool provides some great effects for our patients. It's one of those ones that helps to relax. It's a sedative. It's also great for anti-anxiety as well as an antidepressant.
Now, to get the full effect, because there's CBD oil, can you find it in there? And there's also a way where you can vape it, right?
Absolutely. You know, it really depends on what strain is used to make the oil. If there is linalool in that strain, it'll most likely be passed on. But important thing to know about linalool is that when you are vaporizing a strain that is rich in linalool, it's going to start to boil off right around 388 degrees Fahrenheit. It'll boil off a little bit more efficiently at a slightly higher temperature. So you are going to have to set it up.
Yeah, and then of course, speak to your bud genius to find the full effect of that, but you kind of told us the answer there. Is there anything else that Linalool can do for someone?
Yeah, so Linalool, a couple interesting things I'll mention about it are that it is the terpene that is responsible for the scents and the flavors in lavender, and it's also it's crucial to the body in vitamin E production.
Oh, okay. So it just helps the body produce more vitamin E.
That's
Is that
right.
pretty much what it does?
Yeah.
Awesome. Well, of course, if you got any more questions, you can always speak to Bud Genius at Natural Health Services, like Basil. Basil, thank you very much. That's Terp Talk for today. Stick around in upcoming episodes. We'll talk about more terpenes with Terp Talk.
Don't forget, CBD or cannabidiol, strains of the plant like the infamous Charlotte's Web, is great in the treatment of anxiety, seizures, arthritis, any inflammation, and its resulting pain. It is non-psychoactive, so there is no impairment or feeling of being high. Besides a reduction in symptoms, you'll probably forget you took it. It's available through several producers in oil, self-made capsules, and dried flower.
Probably the most fun of all to say out of strains of cannabis is the Shishkaberry, an indica-dominant strain. The Shishkaberry can also come across as a little deceiving. Hailing from a famous strain by the name of DJ Short Blueberry, mixed with a hardly known Afghan plant, the Shishkaberry takes about 8 to 9 weeks to develop. The result is a flowery plant with a berry scent that looks good to the eye with a purplish tint. Oh, and that deceiving part? While Shishkaberry will make you feel rather chatty at first and then have you chair-bound with a remote control. Good for stress relief, sleep, and yeah, yoga.
Shishkaberry.
Shishkaberry. Yeah, what could you say about the Shishkaberry?
Yeah, man, the berry, in my opinion, is what you can say about it.
Yeah, it's definitely there. It's sweet, got that berry flavor. There's a little bit of a skunkiness going on
totally.
Sometimes hanging on in the background. That's basically because it's got its parents are DJ Short's
Blueberry and some Afghani.
Yeah.
And I think that the clear-headedness, yet relaxed from the Afghani really shines through, and the blueberry scent.
Yeah, that's what you're getting. If you dig deep enough behind it, you can find a little bit of a hashy note sometimes there.
Yeah.
But like it's great. Like it makes me feel like smothered in happiness.
Yeah, rich in linalool.
Yeah, big time. Like it's gonna lock you down, ball and chain to your couch, baby.
Yeah,
That's what
very
that stuff's gonna
sedating.
do.
Yeah, but a great medicine.
It's a nice strain, absolutely.
Yeah.
So, what is an edible? Health Canada regulates licensed producers in the medically prescribed sale of dried cannabis, as well as extracted oils and plants. You can eat those, but they're not edibles, if you know what I mean. We consider edibles to be other products infused with cannabis, cookies, gummies, brownies. So far, the sale of these products, either through storefronts or online, are technically illegal in Canada, no matter what the website says. So if you want your edibles legal, you have to make them yourself with your medical prescription. You can do this by decarboxylating your plant. It's a fancy word for heating. And then basically soaking it in butter or oil for a certain number of hours, and then straining and keeping the resulting cannabis oil in your fridge for your toast or your baking. An easier way to do this is through the use of the magical butter machine we talked about in episode 5. The magical butter machine also allows you to make tinctures and topicals by following pretty easy instructions. There's a lot more info on this on our recent blog on edibles. Visit our website for that.
You can ask us anything. This gives you an opportunity to ask our bud geniuses something that might be on your mind. We have Basil and Hart, our bud geniuses, and here's a question today, guys. It's like a 4-part question, a little bit of frustration behind it as well, and it's from Shelley. And she says, "Hi guys, I live with severe pain from rheumatoid arthritis, and I'm hoping you can help me. I have very little experience with cannabis, and I've had a bit of a rough start. I decided to start with the oil because I don't like smoking. So far, I'm not finding any improvements, and I'm feeling pretty gross on it, upset stomach, bit of nauseousness. I was taking a few mils a day, and now I'm back to just taking 0.5 mil once per day. Is this normal? Does it take some time before it starts working, or am I doing something wrong? Is vaporizing any different as far as side effects are concerned? Any suggestions or encouragement would be great. I desperately want some relief. Thank you in advance, and I'm really enjoying your episodes."
Right on. Wow. Thanks, Shelley. Appreciate you tuning in. The first thing that I'm going to say to you is do not fear the vaporizer, Shelley. Really, if you're looking for acute relief from pain, that vaporizer is going to be your friend. It's not like smoking. We're not talking about actually combustion. We're not talking about burning the cannabis. We're actually talking about heating it up to a certain point where the medicine can get released. So it's a lot healthier. It's actually the best way to consume your cannabis, as a matter of fact. So please try that vaporizer, and one of us Bud Geniuses would be happy to help out if you wanted to come in, or on a Wednesday night. That'd be awesome.
Yeah, and another thing I'll throw in there too is about the dosing. So my first suggestion would be to, instead of that one dose once a day, break that down into 4 smaller doses 4 times a day. We call it micro dosing. So if you're at a 0.5 of a milliliter, you could break that down to 1/10 of a milliliter 4 times a day and titrate yourself up that way. Another thing that I can mention about that oil is that if it tends to keep giving you that stomach ache and that nausea, stop ingesting that oil. Another great thing you can do with that oil is rub it right into that area where you have that inflammation and that pain. You've got a lot of CB2 receptors in your skin. They're the ones looking for that CBD, so they'll soak that stuff right up and hopefully help with that pain there.
Excellent stuff, guys. Again, when Hart said Wednesday night sessions, you can find out more information on that on the website.
Absolutely, absolutely. Check us out online. It's naturalhealthservices.ca. There's lots of information there. We offer free education nights every Wednesday.
And also, if you are having problems, by all means, come in and speak to your doctor again. Very, very important. If you have a question for Basil or Hart, you can ask us anything. You can email your question to us, or you can tweet it at NatHealthServe.